So we will start this session today with the practicals, and we will do all the process in the supine position only, right? So before starting the process, the first process we have to clean the foot. We can clean the foot with the alcohol or with the wet towel. Or I told you, first you have to keep the feet under the warm water and put 1 spoon salt. Okay. On other option, if you don't want to do that, then directly you can clean the feet here only with the help of towel. So there are two procedures. In the process number 1, we are not applying any oil, just we are doing the treatment directly. And in the process number 2, we are applying little oil. So I am taking little oil. This is the cold press coconut oil. Cold press coconut oil. And I have to apply under the calf muscle. Right? So before starting the reflexology session, we can start some music, very slow music, because slowly and slowly we are going to stimulate all the points starting from the lungs, heart, and liver, gallbladder. There are multiple points we are going to stimulate, and we will focus on the point as per the problem of the receiver. So as per our discussion yesterday, when we are studying the reflexology session, we are keeping some pillows here like that. So the feet will be on the our chest level, or what we can do, we can keep this pillow under the knee. Lift your feet. So like this. Now this is the perfect position. So in this condition, the receiver will be very much comfortable, because if someone is suffering with a lower back pain, sometimes it becomes difficult for them to lie down supine for 20 minutes, for 30 minutes. But if we are keeping the pillow, so this is giving her extra support to lower back, and person is not suffering with the lower back pain. Now feet is coming in very right level. Now we can do the stimulation of the points very nicely. So first we have to start applying the oil, checking if there is a cut or wound around, because many person having cut and wound around, then we have to avoid that area. So I'm checking if there is a cut or any wound around. Okay, so now everything is okay. So now we can go ahead. So I have applied the oil just in this feet. My first step, as per our discussion yesterday, is squeezing the calf muscle. So in this position only, I will squeeze the calf muscle. I am lifting the feet so you can see properly. I am squeezing the calf muscle like this. I can make the grip of both complete hand and squeeze the calf muscle. So at least I can do this for 30 seconds to 1 minute, and it is very relaxing. Even you can see in the different angle. So squeezing the calf muscle. Now after completing this squeezing, now we will do the twisting of the calf muscle So we'll twist like this. So we'll start twisting in both the direction, like we are twisting the cloths. Now gently going down and doing the twisting. During this whole procedure, there should not be any discomfort created to the receiver. So I will do this for 30 seconds to 1 minute, and it's really very relaxing. After completing this twisting, now our next step will be thumb press. In the thumb press, I told you we have to press the thumb on this central line, on this central back line. So we can press with the thumb or we can press with the finger, but if we are doing in this position, so better to press with the finger. So I'm keeping my finger like this, and I will gently bring my finger like this. Look at here, I'm doing by other hand. Even I can do by both the hand like this, because there is automatic pressure will be created. This feet in my feet is over my fingers, so there is an automatic pressure created. Just I have to drag my finger like this. My focus just this back line, just this back line. In the acupuncture, this is called urinary bladder meridian, and this urinary bladder meridian balancing our water element and also improving the lower back pain, all the problem connected with the bladder and the lower back pain, and very good for bringing the very good and deeper level of the sleep. So we can do with the both hands. And after doing this, our next step will be dorsiflexion. So we have completed 3 steps. One, simple squeezing for 1 minute. Second, twisting. And third, pressing the thumb on the urinary bladder meridian or in the back central line. Now, coming to the feet, now we'll give the traction here. So we are holding this feet like this. So you can see my thumb. Thumb is in this depression, because if we are keeping the thumb here, we will make the very good grip. But remember, many times even this is very painful. If someone is suffering with any genital problem, this point is also very painful. So you have to keep your thumb very gently. If you are giving too much pressure here and the person is suffering with a genital problem, like if we talk about the female, if we talking about the female, they might suffer with the ovary or uterine problem. This point will be painful. If we talk about the male, and this is point too much painful, means they might suffer with the genital problem of the prostate enlargement. So keep this point gently, otherwise this point might be painful. And other finger on the other side. Look at in this leg how to hold. So thumb you have already seen. Now other finger like this. You can see I am making the very good hold by thumb and other finger. Now I will give the traction towards my side like this. I will give traction I will give traction to my side and pulling this feet to the back side, right? So just I am giving the traction. When I am giving the traction, holding for a while. So because I am doing in this feet, so let's continue in this feet. Now, now we have to do the two types of movement. We will do the dorsiflexion and hold for a while, like 1, 2, 3, 4, 5, 6. Plantar flexion. 1, 2, 3, 4, 5, 6. Remember, many times this plantar flexion is not pleasant for the patient, but this dorsiflexion is very pleasant and giving very good relaxation in the lower back muscle. So plantar flexion we have to do, we are doing the plantar flexion, but don't do too much. Okay. But if you want to do little more dorsiflexion, you can always do. So I am giving the very wonderful traction when I'm doing the dorsiflexion. This is the very good for lower back pain. If I do just 1 minute dorsiflexion, person will feel very good in the lower back. 1 minute means intermittently, like dorsiflexion, plantar flexion, dorsiflexion, plantar flexion. 1 minute means not the continuous. So this is the dorsiflexion. It's very good for the lower back muscle. And there's a plantar flexion. It's a very good for the frontal part muscles. After this, after completing this dorsiflexion and the plantar flexion, now we will do the zigzag movement here. We will do the zigzag movement here. So we will do the zigzag movement here like this. I have already provided you one PDF, and these all things are clearly written there. So you can keep the PDF in front of you. You can take the printout of PDF and you can keep on following as per the steps. So these all things are given step by step. So you can see I am just using this part, the thinner and hypothinner muscle part, and doing zigzag movement. This is very highly relaxing. Zigzag, 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 twist. Even then I will do zigzag twist. I can hold like this and I can do zigzag twist. This is a very good warming twist. So this is the inversion, this is the eversion. Inversion means lifting from inside. So we are using certain group of muscle. Eversion means lifting from the outer side, and we are using certain group of muscle. So this is the inversion and this is the eversion. Inversion, eversion. So we are doing zigzag movement, but very gently. Do not try to do very forcefully. Do not try to give pain. Now, what we are going to do, we will keep on doing zigzag movement, and we can do like this. This is also the variation of the zigzag. So we are doing like this because this area is the full of nerves. So when someone is suffering with a neuropathy and we want to treat some nerve problems, so we have to treat in the dorsal part. So when we are doing like this is also the very part of zigzag movement. This is also, and this is very relaxing. We have to do till the feet we feel the feet warm. So after doing for 1 minute or 2 minutes, we will feel now the feet is warm. Now I can feel the warmness in the feet. Okay. Now the next step is pulling the toes. So I am pulling the toes like this. So we have to do this pulling very gently. I will hold the feet with the other hand and I will do gentle pulling. And then I will do rotational movement in the both direction. Same in all the toes. First pulling, then rotational movement. Pulling, rotational movement. Pulling, rotational movement. Pulling, rotational movement. Pulling, rotational movement. Now, after completing this, we will press the solar plexus. So this is the solar plexus. We will press this point. So we'll keep one thumb here and we'll press with the other thumb. If you see, I am pressing with the pulp, not with the tip. Definitely we'll use the tip after some time, but right now I am pressing with the pulp of the thumb. So this is the completion of the steps which we already discussed in the previous class. Now, it's a turn to stimulate sciatica nerve point. So let's see the sciatica nerve point here. So we can see this is the lateral malleolus. This is the lateral malleolus, right? So from the lateral malleolus, if we go 3 finger up, 3 or 4 finger. So from the lateral malleolus, if we go 4 finger up, so this whole line is called sciatica line. This whole line on the side, this is called sciatica line. So we have to come from this 3 finger up. We are keep coming down. We are keep coming down, and we are continuous following this line till the junction of white and black part, right? So this is the sciatica nerve number 1, because sciatica nerve will make the U curve. Sciatica nerve will start from here, then will go in the bottom, then will turn and go like this. So it is making the complete U. So we have to make the complete U, and we have to stimulate the full area for the sciatica nerve problem. So we are starting from here. Now when we are starting from here, now we have to do the thumb walk or the finger walk. So let's see how to do it. So from here, I can start with my finger, and now you can see, I will do in this way. Suppose I will show you here, like crawling on the surface like this. Very step by step, I am moving. I can do my thumb. I can do a index finger. I can do my middle finger. For me, my middle finger is more comfortable, so I am doing with the middle finger. But in the different areas, we might feel comfort from the different fingers, so we can do accordingly. So let's see now. Starting from here, the person suffering with the sciatica pain, this part will be very painful. At least I will do 5 times or 1 minute, because if the person is having sciatica pain, our main focus is sciatica, so we have to stimulate the area enough. I'm lifting the feet so you can see very clearly. So I have changed my position just for the demonstration purpose. But when we are doing in our clinic, we can just sitting on the feet side, and we can do from this side as well. Now we have reached on the bottom. We can choose our position as per our comfort, as per our comfort, like we can sit this side or on the same side. Now we have come in the bottom. Now this whole area, we have divided the feet in the with the four lines. One is the neck and shoulder line. One is the one is the neck and shoulder line. Second is the diaphragm line. Third is the best line. Then is the pelvic line, right? So this is the best line and this is the pelvic line. So one, two, three, and four. So this area, this whole area is representing the lower part of the body. So this is the head and neck, this is the chest cavity, this is the upper abdomen, lower abdomen, and this is the lower part. So sciatica nerve, leg, genitals, all part will be available here. So sciatica nerves will be here. So this is the sciatica nerve reflex. So this whole area is sciatica nerve reflex. So how can we stimulate this area? Just we keep on crawling like this. We can use other finger, but on the feet, mostly we have to use thumb, because in the feet we have to give little more pressure. Index finger might not give that much pressure. So most of the time we are using thumb here. Now we are coming to the other side, and now we will keep on going like this. This is the medial malleolus. We will go till the three finger up. So keep on rolling. Here we can again use our middle or index finger. Keep on crawling. Now, when we are looking the sciatica nerve reflex, so sciatica nerve reflex is like the U shape. But if you have seen in the image which I've already given you in the PDF, we have given one line like this, vertical line, and one horizontal line, and we have made the T shaped. One is the vertical line, one is the horizontal line. So we have made the line like this. One is the horizontal, one is the horizontal, one is the vertical. So definitely we have to make the U, but we also have to do just below this malleolus, just below this malleolus in the horizontal line till the level of malleolus. This is the wonderful sciatica reflex, and many person are having too much pain here. And if you do this much, this will relieve all the lower back muscles, and person will feel very, very light. In the same way, we have to do other side as well. Other side, if we see here, we have made the sciatica nerve reflex like this, and I told you we have to make the T. So this is the vertical line and this is the horizontal line. So we have to do in this way. Right? So the process in this feet completed. In the same way, I will do quickly in the other feet. So taking little oil. So this will be recap for you as well. Applying under the feet. Even you apply little oil under the leg and under the feet here. Now, first we have to start. We are doing squeeze. We can squeeze with the both hands or one hand. After doing the squeezing, doing twisting. After doing the twisting, now the back central line or the urinary bladder meridian. So I will stimulate with the help of my fingers like this. So keeping my all the finger and just bringing distally. After completing this for 30 seconds to 1 minute, now we are coming on the feet and doing the traction. So for giving the traction, making the grip here and just pulling. During the traction, we are not doing any dorsiflexion and the plantar flexion and just pulling for a while. Now we'll do dorsiflexion, and lower hand will be pulling towards distally, towards my side, and plantar flexion, dorsiflexion, plantar flexion, dorsiflexion, plantar flexion. Now doing the zigzag movement, now doing the full zigzag movement and doing massaging on the dorsal and plantar aspect. We are doing this step starting from the bottom and slowly coming till the top. We also have to do twist. So we can do first twist or we can do last twist here. This twist is very wonderful. This twist is relaxing the spine because after some time we will see this is a whole spine in the reflexology. We will do the treatment of the spine here. Doing the twisting. Now pulling the toes and doing rotational movement. After this, now solar. So this is the solar plexus. We have to keep our one thumb here and this is another thumb and we'll keep on pressing like this. Press and release, press and release, press and release. So we are doing press and release on the solar plexus. Now this is the completion of the basic step. Now we will do the sciatica-nerve reflex treatment. So first start from here and we'll keep on doing till here and making the complete U and doing till here. And after that, I told you this is the T formation here, line and T. And the same T formation on the other side, line and T. So we'll do in that way. Let's start from the here. Okay. So we can stand on the other side for making the proper grip, and we'll do now. So from this lateral malleolus, give going 3 finger up and doing thumb walk like this, like crawling. After completing this, we'll do on the bottom. So for bottom, better to sit on the bottom side, and we'll do and in the bottom better do with the thumb, because thumb can give good pressure. So you can see this is the sciatica reflex. So we are not holding like this when we are doing, we're just doing gently, very gently here. After this, we will do on the inner side, in the other side. So let's see here. Now we will do this side. So we'll keep on doing, and we can use middle finger or index finger here, because here we no need very big pressure. And we will keep on rolling 3 finger up from the medial malleolus. So we have covered the T, we have covered the U shaped. Now this is the sciatica line, and it is making the T shape here. So we'll cover this horizontal line as well. So here also we can do with the thumb or any other finger. If you are doing with the thumb, then you have to do little mild pressure, because thumb might give more pressure. So we are going till the level of this malleolus. Now same we have to do other side. So let's see how to do other side here. So this is the vertical line and this is the horizontal line. So we will do in this way. Now finally, We will again press the solar plexus. So we will press in the same way like we have pressed earlier. Press and release. Press 1, 2, 3 and release. Press 1, 2, 3 and release. Press 1, 2, 3 and release. This solar plexus is very wonderful stimulation. When we are stimulating the solar plexus, it is supplying the energy to the bones. As per the acupuncture, this is called kidney 1 point, and kidney 1 is the point who supply energy to the bones, muscles, and ligaments. So this is the completion of this step. Now, after that, for the patient suffering with the sciatica nerve, we have to do this much stimulation. But many patients are coming to us with the various problem. They might be suffering with the sciatica pain, or they might be suffering with the different types of the lower back pain, and sciatica nerve is not compressed. Even this method is going to work. Suppose some patient is coming to you who is having the lower back pain because of some other reason, not the sciatica. Then what we have to do? This is the medial malleolus. In the same way, other side is lateral malleolus. Then we have to do the massage this area properly. So we can put the oil and we can massage this area properly. Then this is the ligament. The name of this ligament is Achilles tendon. We have to press from here. We have to start pressing from the level of malleolus, and we will press this ligament near about 8 fingers, 4 finger and 4 finger. Why the 8 finger? Because I tell you, in this 8 fingers means 4 finger and the 4 finger. During this 8 finger area, this area is representing the complete spine. Means if you press here, you can treat the neck pain. If you press here, you can treat the middle back pain or the thoracic pain. If you press here, then you can treat the lumbar pain. You can try this method. Suppose someone is suffering with the lower back pain, just you press here and immediately you will see cramps will go away, lower back pain will reduce. So how can we do? When you are pressing this area, you have to press it very gently because we are pressing on the tendon. This is called Achilles tendon. So press, release, press, release, press, release. Now moving ahead, press, release. This gives very miraculous result in the neck pain. So if someone is having neck pain or any spinal issues, you can treat this. Now coming to the middle back pain, press and release. So my target is this Achilles tendon. Press, release, press, release, press, release. Next, press, release, press, release, press, release. Next. So near about 8 finger we have to cover. In the 8 finger, we are covering whole spine. In the acupuncture, we are also putting the needles here and we can see results immediately. The same process we have to do in the other feet. In the 8 finger area from the Achilles tendon, from the this malleolus level, forefinger and the forefinger, we have to praise. So neck pain, middle back pain, and the lower back pain we can treat from all the origin, because every time it's not mandatory that patient is suffering with the sciatica. Many times patient is not suffering with the sciatica pain, and the person is suffering with the problem because of some other origin. So now we will keep on pressing this. Look at here. My target is this lower part. Press and release, press and release, press and release. So we are covering the 8 finger area. That's enough. Try this and you will see the miraculous result. So this practical part is over now.
Sir,
Yes.
you mentioned that if there are some wounds in the legs, we have to cover it. So if there are cracks for a person, then what we are supposed to do, sir?
No problem with the cracks. We can do.
Okay.
But just take care, because if someone is having crack, so better to keep the feet under the warm water, put little salt, so they're smoothing, and if you do few session, then even the person will feel very good, because you will increase the circulation, even cracks will be healed with your treatment. Yeah.
Okay, sir. Thank you.
K1 point itself is solar plexus, is it?
Yes, K1 point is solar plexus.
Okay.
And the feet reflexology. So we have to do at least 2 times in the middle and even in the last. It's mandatory. So it is very effective. It will balance everything in the body.
And last part, you are giving the pressure on the Achilles tendon itself?
Yeah, I'm giving on the Achilles tendon itself, and even in the acupuncture, we are putting the needle in the Achilles tendon.
Oh.
And I have seen, just by doing the massage of the Achilles tendon, you can relieve the neck pain very immediately. And in the 8 finger area, you can relieve the neck to lower back pain. Suppose sometimes you are in the hurry and curry, you don't have much time. So you just try the treatment on the Achilles tendon, just on the Achilles tendon, and you will see the good result.
Sir, in the PDF, it's given that connect solar to sciatica laterally. What is that, sir?
Yeah, we'll see that. I will do that. Because see, right now I have to explain that line. Actually, that line, because we will make the kidney somewhere, and I will explain you. That is in my mind.
सर वन क्वेश्चन सर, जो आपने बताया एचिलिस टेंडन से 8 फिंगर में जब नापते हैं, तो एचिलिस टेंडन के पास क्या नेक आएगा कि
उल्टी स्पाइन होती है, इन्वर्टेड स्पाइन.
Okay.
Like see, first near the malleolus, it is neck.
Okay.
Then going proximally in the upper direction, middle back, and going up, lower back. So a spine in the inverted posture, right? Done. So thank you so much, everyone, and we will meet on Monday now. Okay.